If you just got a diagnosis you can barely pronounce, hydradent, you know what, we'll get to the name, and you're sitting there Googling it at 2 in the morning, wondering what the hell just happened, this episode is for you. Maybe you spent years being told it was just boils. Maybe you saw doctor after doctor, got antibiotics that didn't work, and started to wonder if something was wrong with you, not with your diagnosis. And now, finally, someone put a name to it. So before we get into anything else, I want to say something that I've heard from so many people, something they wish someone had said to them the day they were diagnosed. You are not crazy. You were not making this up, and it was never your fault. Welcome to the Flare Report, a podcast about living with hydradenitis.
Hidradenitis suppurativa.
Right, hidradenitis suppurativa. You know what? Most people just call it HS, and honestly, so will we for the rest of this episode.
Probably for the best.
I'm Maya Chen, and with me is James Okafor, who handles the research and science side of the show, and apparently the pronunciation.
Happy to be here. I've spent a lot of time digging into the HS research, and there's genuinely never been a more hopeful moment for this condition than right now. Maya, should we tell them what the show is?
Let's do it. Quick note first, we're not doctors. This podcast is for education, not medical advice. Always work with your healthcare team for treatment decisions. So, the Flare Report exists because when people get diagnosed with HS, they Google everything they can find. And most of it is either terrifying medical jargon or forum posts at 3 in the morning that make you feel worse. There's not much that just talks to you like a person, that explains things clearly, that gives you hope without lying to you.
And from the research side, the data is clear. Patients are overwhelmed after diagnosis. They have so many questions, and a 15-minute appointment isn't enough. So this podcast is the conversation we think every newly diagnosed person deserves.
Okay, James, let's start with the big one. What exactly is HS? And please, pretend I know nothing.
All right, so forget the textbook for a second. Here's what's actually happening in your body. You know your hair follicles? The tiny openings in your skin where hair grows? In HS, those follicles get blocked. But it's not like a regular pimple where things clear up in a few days. In HS, when a follicle gets blocked, your immune system overreacts. It sends in this massive inflammatory response, way more than what's needed, and that creates these painful lumps under the skin.
The ones people describe as feeling like marbles.
Exactly. Deep, painful nodules. And sometimes those nodules can turn into abscesses. They fill with fluid, they can burst, they drain. Over time, if the inflammation keeps happening in the same area, your body can form these tunnels under the skin, connecting one spot to another. We call them sinus tracts.
And where does this tend to show up?
Anywhere skin touches skin. Armpits, groin, under the breasts, inner thighs, buttocks, the areas with the most friction, which, by the way, is one of the reasons it gets misdiagnosed so often, because those are areas people are embarrassed to talk about and areas some doctors don't examine closely.
Can we just acknowledge that for a second? Having painful, draining lesions in your armpits and groin it's a lot. I've talked to so many people with HS, and the location of this disease adds a whole layer of isolation that doesn't get discussed enough.
Absolutely. And I want your listeners to know, if you've been embarrassed to show a doctor, or embarrassed to tell a partner, or embarrassed to even look at it yourself, that is completely normal. You are not alone in that feeling. But HS is a medical condition, and you deserve medical care for it. Full stop.
So here's a stat that makes me want to flip a table every time I hear it. According to a comprehensive review published in The Lancet in January 2025, the average time from first symptoms to an HS diagnosis is 7 to 10 years. 7 to 10 years, James.
It's one of the longest diagnostic delays of any chronic disease. And it's not because patients aren't seeking help. They are. Reporting by Self magazine found that people with HS see multiple doctors and get an average of about 3 wrong diagnoses before someone finally gets it right.
3 wrong diagnoses. I've talked to people who were told they had boils, then ingrown hairs, and this one comes up a lot, they were told it might be an STI. When you have lesions in your groin and a doctor suggests it might be sexually transmitted, the shame is people tell me they can't even describe it.
And that's tragically common. The most frequent misdiagnoses, according to Healthline and the MyHS Team Patient Network, are exactly what you listed. Boils, ingrown hairs, folliculitis, infected cysts, and yes, STIs, especially when the groin is involved. I've read account after account from patients who were told to just use better hygiene products. Patients given the same antibiotics 6 times in a row, even though it never worked.
So why? Why is it so hard to diagnose?
A few reasons. First, a lot of doctors, including dermatologists honestly, didn't learn much about HS in medical school. It was treated as rare, even though research published in JAMA Dermatology in 2021 and later confirmed in the Journal of the American Academy of Dermatology in 2024 shows it affects roughly 1% of the population. That's millions of people. It's about 3 times more common in women than men, according to the epidemiological data. This is not a rare disease.
1% doesn't sound like a lot until you dig a math.
Right. In the US alone, that's potentially 3 million people.
Second, HS doesn't always look the same. Early stage HS can genuinely look like a boil or an ingrown hair. It's the recurrence, the pattern, the locations. That's what should tip a doctor off. But if you're seeing a different ER doctor each time, nobody's connecting the dots. And third, and this is the one I hear about most, there's a bias issue. When someone shows up with painful lumps in their armpits and groin, and they're a young woman, and maybe they're overweight, some doctors make assumptions. They see the patient instead of the disease.
That's a fair and important point. Research published in PMC in 2024 documents disparities in how quickly different populations get diagnosed, with atypical presentations in skin of color contributing to additional delay. It's something the field needs to reckon with.
Okay, so you've got your diagnosis. Your doctor might have mentioned something called Hurley staging. James, can you walk us through that without making it feel like a death sentence? Because I've heard from so many people who heard stage 2 and immediately thought the worst.
Of course. So Hurley staging is basically a way to describe where your HS is right now. It's not like cancer staging. I want to be very clear about that. It doesn't mean your HS will automatically progress. It's a snapshot, not a prediction.
Thank you for saying that. Okay, break it down.
There are 3 stages. Stage 1, you have abscesses, the painful lumps, but they're individual, they come and go. There aren't tunnels under the skin, and there isn't significant scarring. A lot of people with HS are in stage 1, and a lot of people stay in stage 1, especially with treatment.
That's the it flares up, it calms down, but it keeps coming back stage.
Exactly. Stage 2, now you're getting recurrent abscesses, and some sinus tracts are forming, those tunnels under the skin. You might have scarring in certain areas, but there's still normal skin in between. Stage 2 is where a lot of people are when they finally get diagnosed, because the recurrence pattern is what made someone say, wait, this isn't just boils.
And stage 3?
Stage 3 is severe. It means diffuse involvement, so a whole area, like the entire armpit or entire groin, is affected, with multiple connected tunnels and abscesses. Stage 3 often requires surgical intervention alongside medication.
And I want to say, if you're sitting there thinking, I think I'm stage 3, please don't lose hope. Treatment options are better now than they have ever been, and there are surgeons who specialize in HS. We're going to cover treatment in depth in future episodes.
That's exactly right. Staging helps your doctor choose the right treatment approach. It's a tool, not a verdict.
All right, James. This is the segment I care about most. Because I know that someone listening right now has been told, directly or indirectly, that they caused their HS. That if they just lost weight, or washed better, or changed their diet, this would go away. Can you please set the record straight?
Gladly. And I'm going to be blunt here. HS is an immune-mediated inflammatory disease. That means your immune system is misfiring. It is not caused by poor hygiene. I'll say it again. HS is not caused by poor hygiene. You could shower 10 times a day and it would not prevent a flare.
Say it louder for the people in the back.
HS is not caused by being dirty. It is not caused by anything you did or didn't do. According to multiple epidemiological studies, including data reviewed in StatPearls and The Lancet, there's a significant genetic component. About 40% of people with HS have a family history of it. You didn't choose this. Your immune system is wired this way.
What about weight? Because that's the other one. Just lose weight and it'll get better.
So here's the nuance. Obesity is a risk factor. The research is clear on that. And weight loss can sometimes help reduce friction in skin folds, which may reduce flares in those specific areas. But, and this is critical, thin people get HS, fit people get HS, children get HS. According to StatPearls, onset typically happens between puberty and age 40, most commonly in people in their 20s. It is not a weight-caused disease. Telling someone to just lose weight as if that's a treatment plan is lazy medicine and it's harmful.
It's also really hard to exercise when you have open wounds in your inner thighs. So there's that.
Exactly. It's a vicious cycle, and blaming the patient for it is unacceptable.
If you're listening and you've carried guilt about this, if you've scrubbed your skin raw, if you've crash dieted, if you've avoided the doctor because you thought they'd judge you, please hear us. This is a disease. It's in your immune system. You did not cause it, and you do not deserve it. Okay, deep breath. Let's talk about what you can actually do right now, today, this week. James, if someone just got diagnosed, what are the first 3 things they should do?
Number 1, and this is the most important, find a dermatologist who has experience treating HS. Not all dermatologists are comfortable managing this disease. You want someone who sees HS patients regularly, who knows the current treatment options, who has prescribed biologics before. The HS Foundation website has a provider directory that can help.
And if your current dermatologist says there's nothing we can do or you just have to live with it, get a second opinion. That is outdated information. As of 2025, there are now 3 FDA-approved biologic medications for HS: adalimumab, secukinumab, and bimekizumab, which was just approved in late 2024 according to HAMC. And there are more than 24 additional therapies in clinical trials right now, according to a Globe Newswire report from late 2025. There are options.
Number 2, start tracking your symptoms. This is something every HS expert recommends. Write down when flares happen, where they happen, how severe they are, what you were eating, your stress level, where you are in your menstrual cycle, if that applies. This data is incredibly valuable when you walk into an appointment.
And this is where I want to mention, this episode is brought to you by Violytic. It's a free symptom tracker that lives on your phone, completely private, no cloud, no accounts, no one sees your data but you. Showing up to a dermatologist appointment with 3 months of tracked data is a game changer. You can check it out at violytic.app.
I can confirm from the research side, when patients bring data to appointments, they get better care. The doctor isn't guessing, isn't relying on memory from 3 months ago. They can see patterns.
And number 3?
Join a community. HS can be incredibly isolating. There are wonderful communities online. The HS Foundation, the r/Hidradenitis subreddit, Facebook groups, My HS Team. Finding other people who understand what you're going through is not a luxury. It's part of your care plan.
It really is. I've talked to so many people who say the first time they connected with another person with HS, they cried. Not because they were sad, because they finally felt seen. Someone else knew what it was like to cancel plans because of a flare. Someone else knew the specific dread of a new lump forming. That connection matters.
I'll add a bonus number 4, if I may. Be gentle with yourself. This is a chronic condition, which means it's a marathon, not a sprint. There will be good days and bad days. There will be treatments that work and treatments that don't. Be patient with the process, and be patient with yourself.
So let's recap. HS is a chronic inflammatory skin disease that affects your hair follicles. It's driven by your immune system, not by anything you did wrong. According to The Lancet, it takes an average of 7 to 10 years to get diagnosed. So if you just got your diagnosis, congratulations in a weird way. You finally have an answer.
Find a knowledgeable dermatologist. Start tracking your symptoms. Connect with a community. And know that the treatment landscape is the most hopeful it has ever been. 3 FDA-approved biologics, an oral JAK inhibitor in late-stage trials from Incyte, and according to Delve Insight, over 24 therapies in the clinical pipeline. There is real reason for hope.
Next week on The Flare Report, we're tackling the myths head-on. Episode 2, It's Not Your Fault, busting the biggest HS myths. We're going deep on the hygiene myth, the diet debate, and all the bad advice the internet loves to give.
Looking forward to that one.
If this episode helped you, please share it with someone who needs it. You can find The Flare Report wherever you listen to podcasts. And if you want to start tracking your symptoms today, for free, privately on your own phone, check out our sponsor, Violytic, at violytic.app. And hey, if you're listening to this on a hard day, sitting in a parking lot after a doctor's appointment, or lying in bed during a flare, I want you to know something. It gets easier. Not perfect, but easier. You're not alone anymore. We'll talk next week. Before you go, a quick thanks to our sponsor, Violytic.
Violytic is a free symptom tracking app designed specifically for people with chronic skin conditions. You can log flares, track triggers, take photos, and see patterns over time.
It's actually really helpful for those doctor appointments we talked about. Instead of trying to remember when your last flare was, you've got it all documented. Photos, pain levels, what you were eating, everything.
Check it out at violytic.app. That's VIOLYTIC.app. It's free to download.
Thanks for listening, and we'll see you next time.